Welcome to Ortho Reports. You know, breaking a bone is never fun. But what if I told you there's a new way to fix one of the most common breaks? A broken wrist that could mean a faster recovery and no bulky plaster cast? Well, that's exactly what we're digging into today. We're looking at a fascinating study on a technique that's trying to do just that. Let's get right into it.
All right, so here's our game plan. We'll start with the injury itself. What exactly are we talking about? Then we'll jump into the classic dilemma surgeons face. From there, we'll unpack this new pinning method, see how it actually performed in a study, and wrap up with the final verdict.
Okay, let's kick things off by understanding the injury at the center of all this. So let me ask you something. What do you think is one of the most common broken bones you'd see in any emergency room? Yeah, if you're thinking a broken wrist, you are spot on. But we're zooming in on a very specific type of wrist fracture, one that's incredibly common. It's called a distal radius fracture. Okay, what does that mean? Basically, it's a break in the radius, that's the bigger of the two bones in your forearm, the one on the thumb side, and the break happens really close to your wrist joint. We're talking within about an inch or so. It's that precise location that makes it such a headache to fix perfectly. And believe me, this isn't usually a nice, clean break. It's often a whole lot messier. You can have damage to the ligaments, the cartilage can get banged up. It's complex. And if you don't get those bone fragments lined up perfectly, we're talking potential for long-term wrist pain and dysfunction. This gets even trickier in older patients, where bone density might be lower, making the fracture even more severe. So all of this complexity, it puts surgeons in a really tough spot. They're basically caught between two options, and neither is perfect. On one hand, you've got the non-surgical route. They numb you up, pull the bone back into place, and slap on a cast. It's less invasive, for sure, but there's always that nagging risk that the bones won't heal just right. Then, on the other hand, you have open surgery. They go in, use plates and screws to get everything lined up perfectly. But that means a bigger incision, and you risk damaging the very soft tissues, the muscles and tendons that you need to get your wrist moving again. It's a classic trade-off. So you see the problem, right? The ideal solution, the holy grail really, is to get that perfect anatomical alignment without all the collateral damage to the soft tissue. The question is, how do you get the best of both worlds? Well, that's where this new technique from the study comes into play. It's called the modified minimally invasive technique, and it's pretty clever. So here's how it works. First, the surgeon lines up the bone manually, just like with a cast. But then, instead of a big cut, they insert 3 really thin metal pins, they're called K-wires, right through the skin and into the bone pieces. Think of it like building an internal scaffold to hold everything in place. They're watching this whole thing on a live X-ray to make sure the alignment is absolutely perfect. And then, the ends of those wires that are sticking out of the skin, they get locked into a simple external frame. And this is the real game changer for the patient, because that frame is so stable, you don't need a cast. No cast at all. That means patients can start gentle wrist movements almost right away, which is huge for preventing stiffness and speeding up recovery. And get this, after about 5 to 7 weeks, when the bone's healed up, the whole thing just gets taken out in the clinic. Super straightforward. Okay, so the theory sounds amazing, but the real question is, how did it actually work out in a real-world study? So let's look at the numbers. The study followed 20 adult patients. Their average age was around 36, and it was a mix of men and women, though mostly women. And the researchers kept tabs on every single one of them for 6 months to see how they did. And the results? Pretty impressive. At the 6-month mark, a whopping 90% of the patients, that's 18 out of 20, had either good or fair function back in their wrist. Only 2 patients ended up with a poor outcome. For a new technique, that's a really encouraging result. Now, no surgery is perfect, right? We got to talk about the complications, and the study was upfront about them. So 3 patients got a minor pin site infection, which cleared up with antibiotics. Another 3 had some scarring at the pin sites, and just 1 person had a pin come a bit loose, so they just took the frame off early and used a cast for a bit. When you look at the big picture, those are pretty low complication numbers for wrist surgery. And check this out, the healing time. On average, the X-rays confirmed that the bone was solidly healed in just 40 days. Think about that. That's under 6 weeks. And remember, during that whole time, patients were able to move their wrists, not just sit in a stiff cast. So what's the bottom line here? What can we take away from all this?
Well, the study's main takeaway is pretty clear. They found that this method, this percutaneous fixation, which is just a fancy way of saying pins through the skin, it offers a really stable fix without needing a cast. And that's the key. It allows for an early return to function. This could be a fantastic option, especially in situations where the high cost of surgical plates or the risks of a big open surgery are major factors. But, it's important to be realistic here. The researchers themselves pointed out the limitations, and that's what good science does. This was a small study, remember, just 20 people, and they only followed them for 6 months. The biggest thing, though, is that there wasn't a comparison group. They didn't directly test this technique against a group of patients who got a cast or another type of surgery. So, while the results are super promising, we definitely need bigger studies to confirm these findings. And this whole thing kind of leaves us with a bigger thought, doesn't it? This technique is a perfect snapshot of where medicine is heading: smarter, smaller, and less invasive surgery. It really makes you wonder, what's next? As our technology and our understanding of healing get better and better, how much more can we do for patients with less and less disruption to their bodies? It's an exciting thing to think about. Thanks so much for tuning in.